in, ask away. Don't feel like you need to wait for a break in the conversation or wait until anything is, completely finished. So I want this to be as interactive and as engaging for you as possible. And as I mentioned, most of my degrees have been in exercise physiology or some form of that. So really my purpose today is to talk to you about exercise. And I know that can be a scary word sometimes, but to talk to you about exercise, to talk to you about the recommendations for exercise, to talk to you about why exercise is so hard to stick with, and then to talk to you about the resources that you'll have throughout this program, what you can expect with this program, and how to get in touch with us if you're interested in participating in our part of it. I knew there was supposed to be a little bit of nutrition counseling today too, but I believe she got sick last minute. I know there's a lot of bugs going around. So just to kind of set the stage, I'm not going to be talking about nutrition today. That's not, as exercise physiologists, that's not our area of expertise, but I will make a little bit of a show you guys how we all work together with nutrition counseling, health coaching, and exercise counseling. And then again, you guys will be able to have those resources to you as part of this program. So Mike told me that the title of this program was New Year, New You. And this time of year, this picture, this scene, New Year's Eve in New York City gets passed around a lot. I'm sure everybody watched Mariah Carey this year, right? But what I wanted to talk about is, and I'll explain this a little bit, I'm not 100% convinced with this title of this presentation today. And you'll see why in just a little bit. But I want you guys to think about, maybe not necessarily making a new you, but making the best you. And as we went around earlier talking about why you wanted to be here today, what brought you, what kind of tweaked your interest into tapping into a little bit more information about this program, I mentioned that you're not alone. So I wanted to throw some information up there about January 2017. I have to start with, this is not a research study. This data is not coming from anything other than an online survey. So you might see a few different numbers or a few different areas, but you'll get the gist of most of the individuals, when it comes to setting our New Year's resolutions, have some form of health and wellness or weight loss at the top of that. So as you can see, losing weight and eating healthier is 21% of the population's goals coming January 2017, followed by life self-improvements, better financial decisions, quitting smoking. We also have workout more often down here, number 7. So these probably look familiar. I'm sure, I know personally, I've made a number of these resolutions a few Januaries ago, including this January. But one of the sad statistics is that most of us in this room have probably already fallen off the bandwagon from at least one of our New Year's resolutions already. And that was just, 29 days ago? So the question is, why is it so hard? Why is it so hard to stick with these New Year's resolutions? And what can we do to be better at obtaining them? Or really identifying, is this really what I want? Or is it something else that is driving that? Are there underlying layers to why we want to lose weight or be healthier? So one of the things that we talk about in our field is this idea of stages of change. So no matter what behavior we want to do or set out to do or even think about doing, we go through a series of thought processes. And so with this, we have really 5, based off of this model. There are 5 stages that we all go through when we start to change a behavior. This can be health related, this can be financial, this can be whatever behavior you're interested in changing. And so a lot of times we start down here. This is the very first stage called pre-contemplation. And this is kind of funny to think about a stage because really this is the part that we don't even know we want to change. We're not aware of our need to lose weight or maybe our high blood sugar or our high cholesterol levels. And we're not even thinking about changing our behavior. The next step is when we start to become aware of that. So you might realize that maybe your pants are getting a little tight, or maybe you've had that physician follow-up and they told you that your levels are either borderline or a little high. So we start to become aware, but we're still not ready to make that change. Preparation. This is when those to-do lists come out. So this is when we start to write down and say, all right, next Monday, I'm starting my diet. Next Monday, I'm going to start exercising. This is when we start, as the title suggests, to prep for our behavior change. Then we've got action. So this is when we're actually in the heat of it. So this is when we're trying to exercise 3 days a week. This is when we're doing our nutrition. We're prepping those meals on Sunday nights. Whatever we're doing is actually partaking in that behavior change. And then if we can maintain that behavior for about 6 months, we consider you to be in maintenance. So this is when we feel like you're, in the rhythm and obtaining some of those goals that you set forward. Now, one of the things that they don't have here, which is really important, is at any time during a behavior change, you can do what we call relapse. So this is when we fall off the wagon. This is when we go back maybe 1 stage to preparation, or maybe even 3 stages to say, you know what, this is just not the right time. I'm not feeling it. This was too ambitious, whatever it was. So at any time, you can shift forward and you can shift backwards with your behavior change. So one of the things that we do here is really to try and help individuals, again, particularly related to your exercise, but we do encourage to help with any aspects of the health and wellness goals that you might have, particularly starting off this new year. So going back to this slide that we saw first, my specialties and what my students are currently learning how to do and working with you all for are primarily number 1 and number 7, helping you lose weight by helping you become more physically active. We know when we're talking about weight loss, which is a huge goal, we have nutrition and physical activity, which really kind of are the 2 big contributors to that goal. And then work out more often. And if you look at these numbers, we're looking at 21%, 5%. We can also throw exercise maybe into some self-life improvements in this other category, depending on how specific. Maybe you're training for something. And when you add up these percentages, that's really almost the majority of individuals. That individuals in my position as clinical exercise physiologists can really help. And I think that one of the areas in our field that we're really trying to push is awareness. Because most people don't know what an exercise physiologist is. Usually you're looking towards maybe a nurse, maybe a physician, primary care provider, whatever it might be to help. So really trying to push all of the different things that we can do and all of the services that we're providing. So you guys are going to be kind of on this cutting edge program, which is pretty exciting. So these are kind of what we're looking at, and just again to show where this falls into what people perceive their importance of goals to be this time of year. So as I said, clinical exercise physiology. Not too many people are aware of who we are or what we do. A lot of times we'll be tagged in to say, oh, it's kind of like physical therapy, right? Well, kind of, but not really. So instead of working with individuals acutely, we really try and work with them on a more chronic basis, or working with maybe some more chronic illnesses, as the actual definition comes up with, instead of some of those acute, maybe bone fracture, low back pain injuries. We're also different than nurses. We work a lot of outside hospitals, but we're in this medical field and really trying to help make a name for ourselves with that. So as you can see by this definition, a healthcare professional who's trained to work with chronic diseases where exercise training has been shown to be beneficial. So what I'm going to show you later on is how exercise really does affect blood pressure, how it affects your cholesterol, how it can affect weight loss, and really trying to put some numbers on it, because as we all know, sometimes we see changes. Sometimes with weight loss, we can see it, we can feel it, but other things like blood pressure and cholesterol, unless you're going to that physician's office or that primary care provider's office and actually getting those measures taken, we don't know if our cholesterol has dropped 1 point or 25 points. So I'll show you just how effective exercise can be in just a little bit. But just to kind of set the stage of, you will be working with clinical exercise physiology students. So again, my graduate students who are being trained in this field, who have been working with this program for almost a year now, and really just trying to help you understand who you're going to be in the care with. So what do? One of the first things that we do when we're going to see you is we identify cardiovascular risk factors. So heart disease is very prominent both in men and women in this country, and it's probably the #1 killer, which can be really scary. And again, a lot of times we don't know that we're at risk for cardiovascular disease, and a lot of things that we do put us at risk. So our age, once we start to get over the age of 45 or 55, depending on if we're male or female, smoking, obesity, family history, hypertension, high cholesterol, prediabetes, so high glucose levels, and physical inactivity put us all at risk for having a cardiovascular event like a heart attack. So what we do is we look at your profile and we try to help determine, are you at low risk for cardiovascular disease? Are you at moderate risk, or are you at high risk for that exposure? And then what we do is we pretty much focus on this bottom one because, again, that's our specialty. But what we do is we help develop a personalized exercise program for you based off of your wants and your needs, based off of your physical capabilities, based off of your profile, instead of just making this generic umbrella. So I'm sure you've been online and probably looked up, if exercise has been a focus for you, looked up, what should I be doing? And then they just kind of put this big blanket umbrella statement. And you know what? Maybe it tells you to go outside and jog. Well, newsflash, nobody really likes jogging. Unless that's your thing, nobody really likes jogging. So, we're going to make sure that we're doing something that you want to do, that you like to do, that is beneficial to you, and hopefully going to get you to stay and get into that maintenance zone instead of maybe having those potential relapse. So looking at these cardiovascular risk factors and identifying where you are with that. And then as we start to do this, we're going to help you with that exercise program, as I mentioned. So the number one question that we get is, how much physical activity is enough? How much exercise do I have to do to get some of these health benefits? Any guesses? Yeah. Very good. So the American Heart Association and the American College of Sports Medicine, which are two big governing bodies, suggest at minimum, most adults should be getting at least 30 minutes, 5 times a day for at least 150 minutes. And this is moderate intensity activity. Now, everybody, from what I've learned working in this field for almost a decade, is that everybody has a different definition of what moderate intensity is. So in reference to this, what they're really referring to is just getting out and walking. Walking is moderate intensity. So walking the dog, walking with a friend, going out pushing, playing with your kids on the playground, pretty much anything getting you up, getting that heart rate slightly elevated is considered moderate intensity. So you don't even have to go to the gym to help meet these guidelines. Now, if we want to bump up the intensity and maybe go for a jog or do some other high intensity activity, we can almost cut that required time in half. So when we're doing vigorous intensity, so this is when your heart rate's going to be very elevated, this is when that sweating's probably going to occur, we're actually recommended at minimum 25 minutes. 3 days a week for a total of 75. And the best part about this is you can mix and match it. So you can do a little bit of moderate one day, you can do a little bit of vigorous one day. It doesn't have to be the same boring routine, which I know I'm guilty of. I like to get into my patterns, and then all of a sudden I'm like, all right, not going to do this anymore. So the other really important thing in regards to physical activity is, in addition to the aerobic, which you see up here, it's important to do some strength training component at least twice. So as we get older, we need those muscles for stability, for strength, to help us, even again, as we think far, far, far out into the future, even maintaining quality of life functions like walking up a flight of stairs or playing with grandchildren. Our strength, our muscular strength, is very, very important for that. So these are our minimum recommendations, and you're actually going to get this flyer today with a couple other things that I have for you, just to help kind of set the stage and help remind you. I really like this animation from the American Heart Association. They've done a good job with this. But this just kind of sets the stage for the minimum. So with these minimums, this is gonna what helps get you to those better cholesterol levels, those lower blood pressure levels, and really start to help see some of those health benefits of exercise. We also know that, as you'll see in just a moment, some physical activity is better than none, and any physical activity is better than none. So keep that in mind too, that if these numbers seem a little bit extreme, even a little bit is going to help get you to where you need to be. So again, I've been telling you that this is so important. We have shown through many, many decades of research that exercise can affect not only those cardiovascular risk factors that we've talked about so far, but also your mental state. So going back to being happy, it can release endorphins, it can decrease anxiety and depression, increase cognitive function, increase activities of daily living. So again, making those stairs a little bit easier, making that long walk to the office a little bit easier. Maybe if you have lower back pain, getting in and out of cars, or that first step out of bed, which can be a little painful in the morning. Reducing risk of falls, which gets important with our older individuals. And then pretty much all chronic diseases can have some kind of therapeutic or beneficial effect when we include exercise into those populations. And what we've known, as I mentioned, that some is better than none. When you look at low active individuals and high active individuals, that the health benefits increase. So the more active we are, the more health benefits we're going to get. which can be a little scary again when you talk about those numbers being a little high. 150 minutes can seem like a lot. I'm going to hopefully convince you otherwise in just a moment. But the best part about this is with our lowest individuals, low activity, pretty much doing nothing, not really going out and walking the dog at all, even slight increases to what we're still considered to be low active have huge increases in health benefits. So we get a really big bang for our buck with physical activity, if you will. Another way to look at this is death rates. So individuals that are going to be low physically active are going to have the highest risk for premature mortality and morbidity. And then as we see, even with increasing physical activity levels to moderate, we see almost a 50% reduction in this risk. So again, it doesn't take a lot of physical activity to get some really, really big rewards. And so some of these rewards might include a 10 millimeter of mercury drop in your systolic blood pressure. So that's going to be that top number, maybe that 120/80, which you hear a lot. We can reduce that number if it starts to get into that pre-hypertensive or hypertensive number. We can reduce up to 50% decline in fasting blood glucose levels in diabetics and even help prevent diabetes and maybe some of those pre-diabetic individuals by a significant amount. And then with our lipids, we can see 10% decreases in our total cholesterol numbers, up to 15% decreases in our bad cholesterol, 30% decline in total triglycerides, and we can even see benefits to that good cholesterol. So with a lot of aerobic activity, we can increase that good cholesterol, which is going to be cardioprotective and actually help save our heart potentially from some of those cardiovascular events. And so I'm going to give you a break from listening to me, and I wanted to play this video for you. This is a video by a physician, and he does a fantastic job of making the case of really kind of summarizing everything I just talked about, why exercise is so important, and gives you, I'm not going to ruin it, but gives you kind of an interesting perspective on looking at actually putting on those shoes and going out and doing that physical activity. So I've had some really interesting conversations with individuals after this video, and it's definitely one of my favorites. So. Yeah. That's a fantastic question. So it doesn't matter. So we're looking at total activity of the day. So if you need a 10-minute walk in the morning before you leave for work, 10 minutes during your lunch hour, 10 minutes when you get home, that counts as your 30 minutes. And we prefer that individuals get it in 10-minute bouts. There's evidence to say that you'll still get those health benefits if it's lower than 10 minutes, but 10 minutes seems to be a little bit of a sweet spot with still adding up to get those health benefits. Great question. And that's a big time saver too. That helps with some of the mental stress of blocking out a larger chunk of time throughout your day. All right.
Hi, I'm Dr. Mike Evans, and welcome to this visual lecture I'm calling 23 and a half hours. So I have a big interest in preventive medicine, which can mean a lot of things from, cancer screening to eating more fiber to having a good social network, and I mean that in the old sense of the word. Weighing less, drinking less, smoking less, controlling your blood pressure, cholesterol, and so on and so forth. So all of these things are incredibly important, and I wouldn't want you to minimize your efforts in any one category, but I want to know what comes first. What has the biggest impact? What has the biggest return on investment? What makes the biggest difference to your health? So I did my research, and I found an answer, at least for me, and it's tricky because, all these things are sort of overlapping. But I picked out this intervention, and because of its breadth, it worked for so many different health problems, and that's what I found so cool about it. So just to kind of walk you through a quick list. So this intervention in patients with knee arthritis who receive 1 hour of treatment 3 times a week reduced their rates of pain and disability by 47%. In older patients, it reduced progression to dementia and Alzheimer's by around 50%. For patients at high risk of diabetes and coupled with other lifestyle interventions, it reduced progression to frank diabetes by 58%. Postmenopausal woman who had 4 hours a week of the treatment had a 41% reduction in the risk of hip fracture. It reduced anxiety by 48% in a big meta-analysis. Patients suffering from depression, 30% were relieved with low dose, and that bumped to 47% as we increased the dose. Following over 10,000 Harvard alumni for over 12 years, those that had the intervention had a 23% lower risk of death than those who didn't get the treatment. It's the number one treatment of fatigue, and of course, the kind of outcome of choice there, my favorite outcome is quality of life, which is really all of the above and really about making your life better. And this treatment has been shown over and over again to improve quality of life. So the question is, what's the medicine, and what is 23 and a half hours? So the medicine was exercise, mostly walking, so not triathlons. And let me just put it a different way. I think what I'm asking you to do is, if you think about your typical day, so there's 24 hours, and so you might spend most of your day, this varies obviously, but couch surfing, sitting at work, obviously sleeping. And what the evidence that I'm going to show you kind of tells me is the best thing you can do for your health is to spend half an hour being active, maybe an hour, and that if you can do that, you can realize all the benefits I've described in the previous slides. So let's just take a quick walk through some of the literature. So Stephen Blair, he's a professor at the Arnold School of Public Health at the University of South Carolina, and he looked at this in what's called the Aerobic Center Longitudinal Study, which followed over 50,000 men and women over time. And along the left side of this graph is something called attributable fractions, which is a kind of fancy word, but it's the estimate of the number of deaths in a population that would have been avoided if that specific risk factor had been erased. So for example, turning a smoker into a non-smoker, or a couch potato into a daily walker. And along the bottom is the typical risk factors. You can see the hypertension is incredibly important, and so on and so forth. But the one that kind of applied the most risk was this sort of mysterious CRF, which is cardiorespiratory fitness, which is really low fitness. So low fitness was the strongest predictor of death. And this is important. Most of the trials we see, to be honest, are funded by pharma or other companies because they've got a drug for hypertension or high cholesterol or diabetes, and we rarely see fitness thrown into the mix. And so it's nice to see a trial that's not so siloed. Blair's work is interesting. He also did another trial looking at obesity. What he found was, sort of two things. One is obesity and no exercise. That's a very bad combination, and that's where we saw many of the negative consequences of obesity from a health point of view. But if the obese person was active, even if they didn't have the weight loss, but were just active and obese, that was much, much better, and that the exercise ameliorated much of the negative consequences of obesity. So if exercise is a medicine, what's a dose? So when I think of dose, I think of how long, how often, and how intense. I'm going to give you a slightly mixed message, but essentially more activity is better. But I must say the rate of return seems to decline after 20 or 30 minutes a day. So if you're being active less than 150 minutes a week, or more if you're a kid, an hour a day if you're a kid, my flag goes up in the clinic. So my personal take on this is that the literature draws a very broad brush, and so we see big differences when somebody goes from not doing anything to doing something, and after that the return is more granular. So if we took the Nurses' Health Study, women who went from zero activity to just 1 hour a week reduced their heart disease rates by almost half. So you can break it down, so it can be 10 minutes, 10 minutes, 10 minutes if you want to do 30 minutes of exercise, so it can be broken into 3. Higher intensity, it looks like it's equivalent to less time with lower intensity. But I think obviously the clinical pearl is mostly thinking about your style and habits and your personal cues. So if you're only going to do it if it's pre-booked with friends, I have couples that take a half-hour walk every morning or evening to organize their life. A dog is a great walking coach. The data is showing 67% of dog walkers achieve the 150 minutes a week just with the dog walking. And finally, of course, your commute, getting off stop early, taking the stairs, and so on and so forth. So thinking about that, I'm just going to walk you through some quick slices of the literature. The first one comes from Japan. In the 90s, Japan required all employers to conduct annual health screenings for their employees. And so a large gas company in Japan called Osaka used this to answer a great question. So if people's walk to work was longer, did that reduce their chance of serious health problems? So in this example, high blood pressure. And what they found is under 10-minute walk, no difference. 11 to 20-minute walk, 12% reduction in rates of high blood pressure or hypertension, and over a 21-minute walk, a 29% decrease in rates of high blood pressure. So the authors calculated that for every increase of 10 minutes in your walk to work, there was a 12% reduction in the likelihood of getting high blood pressure. The second exhibit is looking at stents. So this is something we commonly do down medicine. So you can see on the left here, the artery's blocked. On the right, a vascular surgeon's gone in and put in a balloon, opened it up, and left a stent to keep it open, which makes great sense. So a German researcher named Rainer Hambrecht looked at this with about 100 cardiac patients. He got half the group to exercise, and by that I mean 20 minutes a day on an exercise bicycle and then once weekly 60-minute aerobics class. And the other half got the high-tech stent and just their sort of normal activity. And after 1 year, 88% of the exercises were event-free compared to 70% of the people that got a stent. So both worked, but I find it sort of incredible that the low tech made a bigger difference. And you have to remember that the stent just fixes one part of the heart. The next way to think about it is the reverse. So what I call sitting disease. We know that being sedentary is bad for your health, but a researcher named Leonard Veerman wanted to quantify this, and he did so down in Australia in a big study they did there. They found, compared with persons who watch no TV, those that spend a lifetime average of 6 hours a day watching TV can expect to live about 5 years left. I mean, that's incredible. But then I think, who watches 6 hours a day of TV? And it turns out the average adult in the USA spends about 5 hours a day watching TV or screens. So I find this fascinating that we never think of the TV as something that's bad for our health, but clearly it's as powerful as many other risk factors for chronic disease. So I'm just going to leave you with, I guess, two quotes. So one is Jerry Garcia, the singer who is the lead singer for the Grateful Dead, and he said, somebody has to do something. It's just incredibly pathetic that it has to be us. And I think that's true, that in some ways it has to be us. As Hippocrates said, walking is man's best medicine. And so I'm going to finish by asking you a question. And this may have some personal challenges for you. So, you might be very busy with work or kids or both, and you may be in pain or have other priorities. But my question to you is, can you limit your sitting and sleeping to just 23 and a half hours a day? So something to think about. Thank you very much.
Because usually we think about exercising taking up all of our time instead of all of the other things that go into our day. So hopefully you guys enjoyed that. I think it's also kind of fun to see all of the different ways that he incorporates the literature that's out there, and also just to make it a little bit more interesting than watching a pretty dry video. But again, that really hits home on this idea that there's really very few individuals that cannot benefit from not even exercise, but just physical activity. So trying to think about that in a way of exercise doesn't have to be this scary word, physical activity doesn't have to be this terrifying idea, and just really trying to change individuals' perspectives, because there has been a pretty negative connotation with those words to date. So the question is, why is exercise so hard? So if there weren't so many barriers or challenges and the negative connotation, or if it worked a little bit faster, more than 1 in 5 individuals would actually meet physical activity guidelines. So going back to that 150 minutes of moderate intensity, about 1 in 5 US adults actually meets those criteria. So we have a lot of room that we can target, and a lot of individuals that we can target with just trying to increase, again, a little bit each day. And so maybe this might hit home, but I know that this has definitely been a vision in my house before. Again, as an exercise physiologist, I am completely guilty of, even last week, I wasn't feeling well, I was tired, I was stressed, so exercise took a back burner in my life, but getting back on that bandwagon today. So one of the things that we've realized, and this is actually where a lot of my dissertation research came into, and actually it's kind of funny that they mentioned the idea of watching 5 hours of television a day, that's a pretty steep number. And although I saw many of you shaking your heads as if to say, I don't watch 5 hours a day, I try not to watch 5 hours a day, or very rarely think I do. The other thing is, work. So we might not be in front of a TV for most of our day, but we do spend a lot of time sitting in front of a screen, whether it's our phone or our computer or the TV. Those also, it doesn't matter what you're watching necessarily, those negative health benefits are shown that way. So with our behavior choices, there's been pretty overwhelming evidence in the literature that says when I give individuals the choice to be physically active or go home and sit on their couch or make up that work that they didn't get to today or sit on the phone and talk with their loved ones or friends, they're really going to choose to do that sedentary activity. And usually it's because it's more readily available. Usually when I go home, that couch is sitting there waiting for me, and it's a glorious feeling when I sit down and get that relaxed feeling after a hard day at work. I don't have to change my clothes to relax. I don't have to put on sneakers. I can just go home, and it's right there, ready for me. The other thing, again, is that rewarding sensation. We sit down and we relax, and it's comforting, and we get to laugh at our favorite TV show or catch up with our friend and laugh. However, exercise is usually a little less rewarding. It's rewarding down the line when we start to see that weight loss or those muscles coming through. However, in the moment when we are exercising, we start to feel that increased heart rate, that breathing, that muscle soreness, and all of those are like almost like silent psychological factors that next time we go to make that decision, push us a little far. It makes it a little harder to make that choice. So it's really not until we make exercise as readily available to you as a sedentary behavior or make it feel almost as enjoyable or as good that individuals tend to choose this behavior over our sedentary behaviors. So one of the things we'll do as you go through this program is we're going to sit down and we're going to identify what challenges to physical activity are in your life. Because again, as they said, taking a dog is a really good way to get individuals physically active. Well, if you don't have a dog, I'm not going to prescribe you to go outside, go walking with your dog. So I want you to think for just a moment, what are some of the barriers or some of the challenges that you have to making that 150 minutes a day? 150 minutes a week, 30 minutes a day. I put some of my personal ones up here as far as time. And actually, time is the number one cited barrier to physical activity. But again, going back to the video that we just saw, when you think about it, we do have 23 and a half other hours to get stuff done. So it's more of a perceived time than an actual physical limitation of time. And I know that varies from day to day. Believe me, there's been some days where I do not have time. But again, this idea of perceived time. Motivation, again, I told you my motivation last week was running low. I was tired, wasn't feeling good. Things came up, and that motivation started to decrease. Fatigue. This is what I was looking like in my office right before I came down here. So I thank you for getting me up away from my desk and standing for a little bit. And then, of course, weather. As we look outside right now, I don't think anybody wants to go out walking in these snow flurries when it's pretty chilly. So we have tons and tons of challenges. So what we do as clinical exercise physiologists is we assess your risk. We determine what your resources are. We determine what your barriers are. And then again, we come up with that personal, individualized program to help you achieve these goals in the most realistic and positive way possible. And so one of the things that you might be asking yourself is, where do I start? How do I make these goals? What do we have to do? And one of the things when we sit down with you and we actually go through what you want out of a health and wellness program is we're going to make some very smart goals. And by smart, we mean specific, measurable, obtainable, realistic, and time-bound. I've had individuals come in and, when you don't make smart goals, it's really hard to achieve those goals. And think about, I know when I don't achieve my goals that I set out or on my to-do list, I don't feel good about myself. It doesn't feel good. I don't feel accomplished. So making sure that we move through some smart goals with you all, making sure that there's no, unrealistic goals that are being set. And I know it's actually really hard to make realistic goals when we're talking about what's a safe amount of weight to lose, what's a safe pace to lose that weight at. How do we increase muscle mass without hurting ourselves at the gym? Those kind of things that are really, really important. So we're going to make some smart goals with you. And in addition to those of us that will be working through your exercise and health and wellness program, in a world full of many, many choices out there, I really think that this is a huge opportunity for individuals to take part in because, again, with a lot of these places, maybe if you do have a personal trainer that is willing to spend a lot of time with you or a one-on-one health coach in one of these facilities that might also have hundreds and hundreds of other clients at the same time, sometimes you can get lost in everything that this world has to offer when it comes to health and wellness. So here at Star Health in this building, we have 3 primary ways that we're going to be helping you coach your way through health, coach and counsel your way through these goals. So again, my primary focus is this exercise counseling, and I'm going to hand out a packet that shows you just exactly everything that we do, and I'm going to go through exactly what you would be looking at doing from your start with us until you're at the end with us. We also have nutrition counseling. As I mentioned, that's not our expertise. We can talk about calories in and calories out, but actually going for that nutritional guidelines and what I should be eating on a daily basis. We've got some fantastic staff here that will help you with that if you'd like. And then health coaching. Health coaching is a fantastic opportunity, much like exercise counseling. Not too many people understand what the difference is, but health coaching is here to help you balance everything that's going on, including what we draft up for you in these other programs. So one of the things I want to mention is, actually I can just go ahead and pass these packets out. One of the things that we're doing right now is all of our exercise counseling and coaching is free, which is very uncommon in most other places. Did you have a question? Okay, just stretching. Yeah. If you guys want to get up and stand too, don't feel like you have to sit. I'm like preaching about standing all day, and then you guys are just sitting here. So what I'm handing out in this packet, a couple different things, which you're going to see is essentially that free exercise counseling coupon up there. And with this program that you're going through, you guys would essentially be getting it at the discounted rate through the program anyway. But I wanted to give this to you because I wanted this to go to a friend or a spouse or somebody else in your life that might want to take this adventure with you or might want to participate in some of this with you. Because again, the data has shown that when we do this with accountability buddy, it usually works out. And plus, it's just more fun not to do things by yourself. So you've got a free exercise counseling. I crossed out the expiration date, so please don't worry about that. Our contact information is there. And what you'll see are the other two packets that you have that don't look familiar yet. This is the American Heart Association guidelines that I showed you all the way at the end. So you have those to take home and maybe use as some motivation for you. Put it on your fridge if you want. But the other two pamphlets and packets are just essentially everything that we offer through exercise counseling, the fitness testing, and then we also have a little bit of information on our nutrition counseling on the back of this too. So being involved with this program, what you can expect is essentially the first day that we would have you come in would be for your fitness assessment. And we do have, as you'll see, a variety of fitness packages, but the one you'll be receiving is this first one, this bronze level. And so you'll come in, we'll do that health history, we'll assess all of those risk factors that we talked about. And then from then on, we're going to do some body composition. So we're going to look at how much fat-free mass, so essentially how much muscle you have in your body, and then how much fat mass. This will help us classify some of those other risk factors like obesity. What else? We will also do some flexibility testing. So think back to elementary school when you guys had to do those sit and reach tests. We'll be doing a few of those. And we'll also be doing some musculoskeletal. So again, we really want to see where you are in all aspects of exercise, not just cardiovascular. So how flexible you are, muscular strength and endurance, and then we'll also do a treadmill test. So you'll come in, and we're going to start the test off nice and easy. You'll be walking the whole time. And what we're going to do is just make that incline and that speed just a little faster every couple minutes. And we're going to take you, we're not going to take you to your max. We're going to work up a nice little heart rate and a little sweat, but we're not going to push you until you can't go anymore. And so what we're essentially looking at is we're going to look at that fitness level. So think back to the video, they talked about that cardiorespiratory fitness level, which was so important and the number one identifier for risk for mortality and morbidity. We're going to look at that, and we're going to determine where you rank as far as, national percentiles and other individuals of your age and gender. And so after that, we're going to collect all of that data. We're going to write it all up for you. We're going to explain what it all means, because again, once you go home, if you're anything like me, it's in one ear, out the other sometimes. And then we're going to ask you to come back in about a week or whenever works for your schedule. And with that, we're going to sit down with you. No exercise this time. This one's just nice and relaxing. And we're going to go through those goals. We're going to go through what you want out of this. We're going to go through those resources. So we go through a series of questionnaires and a series of documents that really help us pinpoint where do we go from there. Then we spend the next week creating that exercise program specifically for you, and you can have your choice. We can either email it to you, call you on the phone, and go over it with you, or you can come back in for about a 20 to 30-minute meeting where we just talk about this is what we want you to do, this is how we do it. Those initial exercise programs are about 6 weeks long. So then after 6 weeks, it's up to you if you want to continue coming back and seeing us, or if you want to just take the ropes and go on your own. So if you like what you're doing and continuing it, feeling stronger about it, or if you want to come back, revisit us, and we can kind of do everything over again, as far as revisiting the goals and where you're at in the next 6 weeks. So that's kind of just a little overview. Again, that's just for the exercise fitness counseling and testing. That doesn't include any other visits that you would have with the nutrition or the health coaching. What questions are there? I'm not that good of a presenter, so I know I've forgotten something, right? Mm-hmm. Oh, I'm sorry. We've been asked to.
I know
It's on.
that we did the bronze level. If we wanted to get in a higher level, could we pay the difference?
Yeah, so we can talk about that. Don't worry about the prices on there anyway. The prices are really for just individuals coming off the street that wouldn't be involved with this resource. So the pricing on there would be even much higher than what you would be getting it for. We can talk about it. There's certain things, maybe with the body composition, that'd be more beneficial. I think with like the silver package, it also offers the maximal exercise test, which has its benefits. We can measure that fitness level instead of estimating it like we do with the bronze, but usually they're so close. That's a very much more uncomfortable test to put individuals through, and usually you're not getting a whole much more information unless you're an athlete and looking for really certain numbers throughout that test. So definitely we can personalize anything that you see on there to help accommodate, again, your goals. This is completely personal. And again, that is the benefit of coming to these facilities and doing it here instead of just being pushed into kind of a one size fits all program. Great question. Is there another question?
Based on excuse me, based on the exercise prescription, is it based on obviously what the individual has in terms of access to, whether they have equipment at home, whether they go to a workout facility?
Absolutely.
Okay.
So hold it just in case you have a follow-up question. So that comes into your resources. So do you even want to go to the gym? Do you want to pay for the gym? Do you want to do stuff at home? Sometimes individuals really don't like working out at home because, as we mentioned, there's all of those temptations as soon as you walk in the door, like that comfy couch or that dinner that's waiting for you when you walk in there. So depending on what you're willing to try, what your financial situation looks like, where you're willing to travel to, whatever you are up for, we will accommodate that into your exercise prescription. Absolutely. Any other questions? Yep. Getting my steps in, walking the microphone around.
If we bring somebody with us,
Mm-hmm.
is that to the next thing, or how's that work?
So this is essentially offering that entire service to them. So that coupon right there is for anybody that's willing to come through and do the fitness testing and the exercise counseling. We don't like to do two people at the same time unless there's, a spouse and time is of the essence and you can't make it in on 2 days because of childcare or just work obligations. We have made it happen, but it's going to extend the time that you're there with us a little bit longer. So that's for the entire program like we just talked about, but usually we like to do a one-on-one session. That usually keeps people a little bit more honest, too, with some of the things that we talk about.
Said the entire thing, is that what we had back when we got tested? Does it include that?
Oh, so with the cholesterol, no. So this is just essentially from that first visit with us where we'll do the fitness testing through the exercise counseling and prescription. Yep, so no finger pricks or anything like that. And just for an FYI, you'll see this in the email if you reach out to us. We do try to do the exercise fitness testing in the afternoons, usually on Tuesday and Thursday. We try to run from 1 to 4. We know that's during the workday, but it helps us with safety measures and people being in the facilities, and our students have a pretty tight schedule, so it's when it worked best for them. We also try to do the exercise counseling in the mornings on Monday and Wednesday from 8 to noon. If those times do not work for you, we will do our best to accommodate your schedule so we can do things after hours if we need to, or or in the morning if necessary, but we try to stick to that schedule as much as possible. So just, again, I don't want to throw anybody off by having those dates and times. Plus, the area that we do the fitness testing in is in pretty hot demand in this building, so we have to make sure that we're sharing it with everybody else. Yes?
Are the services available for people that were not able to come to this lunch and learn
Absolutely.
as well? Okay.
Absolutely.
My
Yep.
coworkers.
Yep, they're filming it today, so hopefully
Okay.
everybody will get that too. Anything else? Well, I hope this was informative. I hope this was engaging. I hope you all had as much fun as I did being here this afternoon. So hopefully, even if it just puts a little bit of a spark into maybe moving you from that pre-contemplation to contemplation, or maybe that pre-contemplation to maybe even action. So if you're not ready there, again, we're here to help with whatever stage you might find yourself in, wherever you might want to see yourself going. So please feel free to reach out to us at any time, and we look forward to working with you.